Hello everybody. This time last week, preparing for the excitement of an Olympic opening ceremony, but thoughts, my own thoughts, and I suspect many of yours, are with Elsie, Alice and Bebe's families in Southport amid truly terrible scenes. A reminder that on an ordinary day, on any given ordinary day, happiness can be shattered and bravery can be very ordinary, and I'm sure all of our thoughts tonight turn to those adults fighting for their life after such heroic acts. We're in the lull at RDaSH, aren't we, between the AMM and the inevitable excitement of the flu vaccination campaign, or the excitement of trying to find yourself a room for the first learning half day on September the 3rd. Over the last few days, myself and exec colleagues, as we do every 8 weeks, have spent time with each of our care group leadership teams. And I just wanted to draw one thing from each of those 5 conversations. I'm constantly impressed by the resilience and the dedication, the kindness of our care group leadership teams and their determination amid all the many things that are thrown at them to keep moving things just a little bit forward in terms of patient safety and the experience of people working in our teams. So there are many commonalities between the care group's efforts. There are a few subtle differences. I'm thinking right now of colleagues in the North Links Adult Mental Health and Talking Therapies care group who really are leading the way with their efforts to get many of our, what we might call our 100% standards, our always standards, into place consistently in our care environment. So I mean by that things like compliance with the Mental Health Act, including Section 132 rights. I mean making sure that our consent model for Oxyvision is right, that we always do our must assessments, that some of the basics of care are always done. But then when you think about when things go wrong in healthcare, it's often the basics of care that have not necessarily happened. So shout out to Vicky, matron teams and others who are leading the way within North Links in that effort. And I'm sure in saying that, other teams are hot on their heels. For a little bit over a year or so now, there's been work going on to reimagine the older people's mental health model across community services and inpatient services associated with Windermere. And we listened to Sonia and the team talk about their intended plans for implementation over the next few weeks. In some ways, it's a bit of a back to the future, because I'm fairly sure that the model of consultant inreach with consultant medical staff being based in community teams is probably how things were a wee while ago. Really important that we've got multi-professional coverage across each of our community-based teams, including, as I'm somewhat obsessed with, the ability for senior staff to actually go on vacation and services to still continue. I'm sure as we go through the autumn we'll see implementation of those changes, and then we can evaluate them. It's just one of a number of quite big service changes that Laura Wiltshire and her team are leading the way with. We've got an attempt to grow our assertive outreach service very much in the way we did in Rotherham last year, but this time in Doncaster. That's coming up as well. In our Rotherham service, although there is a lot of new stuff going on, we actually spent time looking back at the changes to assessment formulation pathways that were made in the early part of this year. Sometimes the management process just moves on quick. It doesn't go back, doesn't have a look, doesn't evaluate. There's a big change there to how we work with primary care, but also a big change to remove significant waiting lists that had built up in those services. So I'm grateful to Andrew Brankin and his colleagues for all of their work to change those pathways, and we will carry on working with GPs and with other stakeholders within the care group to make sure that there are not unintended consequences from the changes that have been made. Now, I'm not going to talk about neurodiversity in our adult physical health and neurodiversity care group, because I don't want to jinx it, although I believe yesterday we went live with the use of SPA as our main communication portal for neurodiversity services for adults. A big change and an exciting one as we move to bring teams together across North Lincs, Doncaster and Rotherham. I was actually going to mention the wound care project. The wound care projects are really exciting. I very much hope Steph Bly's managed to turn it into a research project proposition to try and see if we can cut by almost a third the time it takes to recover from wounds in our care. It's a really important project. It's something that the team have been very focused on. We've bought new equipment to see if we can make it happen. And it's an example of the kind of, I suppose you'd call it, bottom-up quality improvements that are going to be right at the heart of the quality and safety plan in the organisation. Not everything is about standardisation. You know, some things are about innovation, about experimentation, about study and research. Yeah. So who's left? Who haven't I mentioned? Well, I haven't mentioned children's services. Now, a lot of our meeting was taken up with a conversation about the Thrive model that we're trying to reinvigorate and again bring consistency to across our geographies. But right now, as I speak, there are people working enormously hard to try and get our services within CAMS down to a 4-week wait. Whenever I mention this 4-week wait in CAMS, somebody says to me, but Toby, people are getting advice from the very start of their referral into our services, and I recognise that, but the commitment that we gave was to get specialised intervention-based services to those people who are triaged as needing it within 4 weeks. And if you think about the national conversation about a 17% growth in mental health prevalence among children and young people over the last few years and post-pandemic, it simply couldn't be more important. Not only that we are able to intervene and provide support rapidly, but also that we're able to give people confidence about the waits that they will experience. Of course, confidence about the waits you will experience may mean more people are referred. Well, good, because the reality is that there is unacknowledged need in our communities with maybe 1 in 6, 1 in 8 children not consistently attending school, and there is a real tendency to put off seeking care in the belief that services are stretched and under pressure. I don't deny the challenges that we face, and I'm in constant admiration of the work that our teams do, but it must be right that we're able to intervene with specialised services as early and as rapidly as we can. So many congratulations to Christina, to Kate, to Roberta, to Kate and the wider team for the work they're trying to do to not only deliver the 4-week wait, but then be able to back up that guarantee. It's an early part of Promise 14, you see. You thought you'd get through a whole film without me mentioning any of our promises. Read the words on this promise quite carefully. They're very deliberately chosen. They're in 2 parts with 2 different dates. Have a think in the service where you are about your journey to get to that point.
Sure.
I want to end where I began, by acknowledging things that are happening in our wider society, and I would draw your attention as this film ends to 1 or 2 things coming up in our local community over the weeks ahead, including just around the corner from me in Balby at the start of September. Cheers.